Hello, everybody. Welcome back. I'm so excited to have my next guest on the show, Dr. Tommy Rhee. He's a sports chiropractor and pioneer in regenerative wellness. He's dedicated over 3 years to the development of regen, which we're going to talk about. He's been practicing in the field of chiropractor. He's a chiropractor since 2006, and he once served as the official team chiropractor of the Tampa Bay Buccaneers. I'm a Denver Bronco fan, Dr. Rhee. I'm sorry. From 2015 and 2018. Dr. Rhee, thank you for being on the show, my friend.
Oh, thank you very much for the invitation, and I'm excited about this.
Yeah, it's good. I always love, before we even started, for the listener, I was telling Dr. Rhee that I love what he's doing with stem cell, regenerative stuff. I mean, that's been on the news for the last handful of years, and I know there's so many positive benefits from that. So we're going to dive into that. But I want to just kind of talk about your background, sir. I know you're in the military, you're in the Navy. But first of all, what got you into the Navy? Why did you want to serve?
You know, I think like everybody that's growing up in the 80s, we were kind of rambunctious and all that stuff, and I was a little bit too in the excess and got myself into I was like that kind of kid that defied everything, and that includes from
Me
education and
too.
everything, so you know how we were, right?
Yeah.
So we had that energy that we just needed to release, and that was released by either going out and partying or doing something silly. And then I got to a point where it was a big decision in my life, either go down the course of the law and going to jail and doing those
Let me
those
see.
things, or go,
Law.
yeah, yeah, or go in the military. So that was back then when they encouraged, like, look, you got one more chance, get in the military,
Yeah.
clean yourself up, and then get yourself straightened out for real world. So let me tell you, the military was the best decision, best choice. It really teaches you things of self-respect, self-respect for others, and how to like set goals and how to achieve those goals. It really taught you in these little micro victories how to become a better person. And it breaks you down to where you should be, all as one down in boot camp, and it brings you up to where you should be at, where it's a more confident and more like assuring person.
Yeah.
So the military was fantastic for me.
Yeah. I love it. I always thought, Dr. Rhee, that, and this is just my opinion, I think all young people, because I know some countries have it, like Israel, for example, it doesn't matter. You have to join for a minimum of 2 years. And I don't know if it's feasible in the United States. We're much bigger. But I think young people should serve. I think it should be a requirement at some. You have to serve at least a minimum of 2 years for the very reason you said. It gives young people some direction. And that's not saying that some people or some young people don't have direction, but a lot of them don't. And it gives you that foundation, that direction, teaches you discipline, like you said, uh, you know, get through tough situations, resiliency. So yeah, I was the same way. I was kind of rudderless for a while. I didn't know what I was going to do. But I am so glad and blessed that I went into the military because it gave me that foundation.
Yeah. Nothing's better than I think the best feedback that I got that I made the right decision is when you get out of the military and then you go to college. And when I went to college, I'm surrounded by other freshmen and sophomores, and the maturity level is so much different. They want
Yeah.
to go out hard, but they have excuses of not attending the next day's class, right? And I know how to go out that night, but still be in some type of like obedience to take that attendance in that class and then continue on as nothing happened. So the military trains you in all aspect of being responsible. So
Yeah.
that's what I really identified with. Wow, I'm a little different in thought process than these other guys.
Yeah. So what led you into the medical field?
So that goes back with my dad. So my father was a surgeon, and of course, relatives and uncles and aunts and all that stuff, all doctors. And then it was like kind of like osmosisly thinking that it was inbred into me to be a doctor. So it was like, well, I see it
Of
all the
course.
time, and it's like, well, I guess I'm going down that path right there. But I had to take a little detours here and there to finally figure out that it was always in me to help people. And then since I was a physical guy, I love sports. It was just it's just perfect marriage between like helping people in medicine and chiropractic and helping people in sports world. So it kind of just blended well together.
Forgive me, doctor, because I know what field of chiropractic is and what chiropractors do, but what is what's the biggest challenge that you see in clients when they come to you? Obviously, back issues and stuff. I mean, is that the majority of it or what?
Yeah, anything that first they always think about the spine. If it's from the neck to the mid back or low back, it's kind of like that pain. But when you're in the sports world, you're looking at the soft tissue around the joints, and not so much like the spine. You're talking about shoulders, knees, elbows, anything that has to do with like the joints of either extremities or some sports related injury. So when you look at a normal chiropractor that just thinks about just a nerve innervation that's interrupted by some like a disturbance in their alignment in their spine, well, they set you up and they do that adjustment or cracking your back and it kind of releases that spine to make it more straight or more aligned, right? So we take it to the next level by saying things like, all right, what's causing that? What articulation of the joints are irritating it? Or even more so, why is your shoulder giving you that almost like that numbness down your arm? Is it from your neck, or does it come a thing called thoracic outlet syndrome, or something that may be caught in your axillary, your armpit area, maybe down your elbow? So we trace it in that mechanism, and then figure out from what soft tissue around the joint is giving you that problem, and then we work around the soft tissue, and then we'll get to the joint.
And how many, and I can't imagine what you saw in terms of your field of medicine when you were the chiropractor for the Tampa Bay Bucks. I mean, the injuries and all the issues that players were dealing with.
Yeah, I mean, the things you hear and see on TV, you're going to see it there. So from all the way from sprained ankles to contusions to big tears, grade one, two, and three, and the muscle tears, ligaments, tendons, fractures. And one of the big things that you'll hear about are like that typical neuropathy or like a disc issue that you can definitely get affected by your play. That's kind of masked by like pharmaceutical pain meds and stuff like that. The thing is that when you see a complicating case, sometimes people will chase just the symptom and not the cause.
Yeah.
And because the season's so short and it's such a almost like like a triage when you look at these athletes because you're trying to get them back to normal as soon as possible because it's on the cycle is once a week, sometimes shorter, right? Because of a Monday night game or a Thursday night game, you got to get them out. So when it comes to difficulties of patients in their rehab world, I was so when I was at the Bucks, I was a chiropractor, but I also took on very difficult type of like injuries that needed more attention. So they would take their high class type of injury and then they would send it to me, and then I would work with them on a longer period in my office and then get them back on the field. So some of the classic things that that I would see in my office are like nerve entrapment that's affecting them. Either like it mimics it like that pain that's going down your leg. So
So
we had a one.
what's nerve entrapment, sir?
It's like so there's a bundle of nerves that come out of your low back called a sciatic, nerves. And then you think about these entrapments, meaning that the nerve is cut off like a garden hose. When you pinch your garden hose, the end of it doesn't flow that water. So you have to unclink that garden hose to get that normal water flow.
Is that kind of like a sciatic
Yep, sciatic nerve. So there are
nerve?
yeah,
Okay.
so there's points where it gets caught. It can get caught in the lumbar disc where the nerves from the central canal, the spinal cord, kind of comes out and it comes out of these branches. And then when they come out of the spine, the actual vertebrae, it comes out and it goes through like your this area of your glute. And it's like there's a thing called a sciatic notch where it's in part of your pelvic, but then there is what they call a muscle called a piriformis. So there's a common syndrome out there called a piriformis syndrome. It can be caught there. It can either be caught right by your hamstring if it's traumatized, because if you get inflammatory response, it swells up. Well, anytime you kind of have these like the occupying space, it plays havoc on nerves and it compresses it. So the object is that you want to decompress the nerve so the nerve has an ability to like floss through. A nerve kind of moves along the tissue. So sometimes the muscle's too tight or inflammation or some type of adhesion, it'll grab the nerve. So when you do a movement, it mimics like a nerve getting like pinched, and
Oh,
then
I
the
see what you
symptom
mean.
shows down on the leg or the calf or the toes. So those are the things that are kind of tricky. You got to find out where it's entrapped at. When you entrap it, then you've got to release it. When you release it, it's painful, but it takes the pressure off.
Yeah.
Then the
And
second, yeah,
begins to heal, correct?
big as heal. But the secondary thing is that once you release it, the symptom's still there because just like when you went to the dentist and you do something with your, if you have like a root canal done or maybe a molar or your wisdom tooth out, with a nerve because you've like numbed it, it may take several weeks to months to get your nerve back to normal function or feeling. So just like that kind of scenario, it could happen down your leg. So when you take that entrapment off, now you have to kind of like re-energize or reteach that body to turn on that type of motor function
Wow.
of that area to activate again. So it
Yeah.
takes time.
Yeah.
So when some people go through like a chiropractor therapy or some physical therapy and they feel like they're not getting better, but depending on certain kind of therapists, they know the sequence of events. If they know it, they'll reassure you you're doing fine. Just continue on therapy. Some patients just stop too quick. So these athletes, because they're on short term, they want to get it quickly done. You've got to talk to them and say, this is the process. This is where it's going to be at. There's no secret pill. There's no secret quick stuff. I mean, that's the hard thing because athletes are really like on demand. The NFL contract is so weird. People say I'm getting $10 million. Well, there's a lot of like prerequisite to get that money. You got to
Yeah.
have this many games, this many plays, this many
You
snaps,
can't do
and
certain things, extracurricular activities like skiing or stuff like that a lot of times.
oh yeah. So now when you look at like other contracts of other sports like NBA or baseball, I mean, when it says $10 million, you're getting that money. There's no kind of incentives like I play 30 games and we'll give you another million. I mean, they just get that money. So
Yeah.
that's what the difference. NFL is so unique, it doesn't really guarantee that number.
Yeah. And I guess I was always, I mean, I feel kind of selfish for saying this, but I'm blessed because I never, being a cop, I told you I was a cop, doctor, and for 23 years, I never had any like back issues, knock on wood. I told you what I did in the military, jumping out of perfectly good airplanes. I never had any significant background or back problems or any kind of where I need to go see a chiropractor like you. I'm not saying I wouldn't in the future. I guess my point in all that is other things I imagine come into play, like fitness level and how good of shape you're in and what you're putting in your body. I mean, correct?
Yeah, all that goes. One of the common threads about low back pain that I've noticed in this office, weak legs. Weak, like you really don't understand about your leg strength and how important it is, especially when you like a lot of people that may feel like they have good flexibility, but when they go and touch their toes, because of their hamstring being weak, they'll go to a certain range because when you lengthen the muscle, it becomes very weak. So when you're weak, that you can't bring your torso back up, well, you lock your hip joint at a certain angle. So the next thing that keeps moving
Oh,
is your lumbar. So it's that kinetic chain. So now your lumbar is not really meant to like bend forward and backwards a lot, right? It's mostly like stabilization of the visceral, the organs, right?
hmm.
So there's a little bit of play there, but the problem is that when you have like poor leg strength, that's where you see problems. So when people go pick something up, they have weak legs, so they don't use their legs. They just pick it up all lumbar, low back. And then all of a sudden, you strain a muscle, you get that thing called a slip disc or the herniated disc. So I always tell everybody, to really understand how low back can really like play havoc on you, let me see your leg strength. And then you see the leg strength, the leg weakness just by simple body weight squats. So if I have a patient that have like good leg strength and they have low back pain, well, there's something else going on. It's not
Yeah.
going to be due to poor posture or the leg strength. So most of my low back people have poor strength in their legs. That's the big thing that I notice. So
What about core? Because
core
that's important too, right?
core is important because that's the stabilization of the center, right? So the thing with core is that, you know, what I what I want everybody to understand is that core is just basically just engaging your center of gravity in its center, right? Meaning that it's not so much displaced forward. If you're obese, you're displacing. It's like holding a box close to you versus spreading it all the way out here and carrying a box up a flight of stairs. It's difficult. So that's why you think about core, you've got to pull everything to the center of like gravity area.
Yeah.
So when I see core, it's about like, not only is it abdominal, but you've got the lateral, you've got the obliques, you've got the paraspinals in the back. It's everything, and just keep it like in a tent. So when you see a tent, there's a pole and there's a line going to the north and south. You got to make sure it balances correctly because one
Oh
is too
yeah.
stronger than the other. It'll lean that pole down, or the other one has to overwork itself. So you got to make it balanced at the same
Yeah.
time.
Well, and it's very interesting. I know leg strength is important, but I remember growing up, it was so that's why I asked you about core. It was always, I remember hearing like in the military, and even when we used to work out in law enforcement, I mean, yeah, there was a mention of leg strength. You want to be able to squat and stuff, but I was always taught, yeah, core, core, core. If you have a strong core, you're not going to have back problems. That's not
Yeah.
necessarily the case.
I'll be honest with you, man. You got lucky on your from jumping that many times out of all those aircrafts. Let me tell you, everybody I know that wasn't any type of airborne, they all have low back pain.
I don't have any back problems, Dr. Reed, but I do have knee problems now.
Oh, okay. So you had the big squat on that knee, huh?
Yeah,
Bear
yeah.
that weight.
So I had, and this was a long time ago. This is probably about 10, almost 15 years ago. I had meniscus surgery on my left knee because it's just, and even now my knees are, I'm always like in a kind of a state of pain on a scale of 1 to 10, 10 being the worst. On most days, I'm like maybe a 3 or a 4.
Mm.
But the one thing that that I never did is I'm one of those guys that, because I could go to the VA, but I always felt bad because, so many other people, are worse off than me. And when I got out of the military, when I was ETSing, and that for no, people who don't know what that is, I mean, that's getting out of the military. I never went to the doctor and said, "Hey, I'm having problems with my knees." But I always thought somebody else deserved it more. But anyway, the point is that now, I don't have back issues, but I do have knee problems. And then a lot of that's just getting older. I'm 56, so I'm getting up there in age. So
Isn't it something? Let me tell you, I'm right there with, I'm 57. So, you know how, like, when we were younger, not even that, maybe 40s, we can jump out of the back of a pickup truck. It's no big deal, right? Now it's like one of those things like you have to think about it. Go, wait a minute, what's going to happen? I mean, what's going to blow out of me if I just, so, you take that old approach of stepping down, looking around, and say, oh my gosh, I'm there at that age now.
well, and the mind, I mean, my mind is like the mind is willing, but
Yeah, yeah.
the body's like, don't do that.
Hey, do you remember the times when you can sit down like in a chair and get up and do a full sprint, just
Oh
cold
yeah.
turkey, just go, right? Remember those days?
Oh yeah. I can't do that anymore.
No, 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 no. Now you have to
I'm in
like
bed by 9.
how about now you have to kind of like do the dynamic stretching, warm it up. Give me about 5 minutes, and let me
Well,
I'll get going.
now I tell my fiance, Doc, and I don't know how you are, but I don't really care. I was big at one time, bigger, muscular wise. I'm still a big guy. I'm 6'1", about 240. Of course, the BMI probably says I'm obese, but I don't like the BMI. But
No, nobody
anyway,
cares.
I'm not really concerned about bulk anymore at my age. Like you mentioned, and I'm concerned about flexibility
Yes.
and doing, being flexible, doing some, I do a lot of sit-ups. I stretch a lot because I think that's more important at my age.
Yeah. Something weird about that stretching. So if you look at like elderly patients that have that longer lifespan or act lifespans, one of the common threads are that the females live longer than males. One of the common things that they have is their flexibility. So when you see cardiovascular diseases and you hear that word like hardening of the arteries, well, it's because the connective tissue is starting to like really like get like homeostasis, meaning that it doesn't do any type of expansion or contraction because
Yeah.
you want that movement. You want that full range of
Yeah.
motion. That's why, I mean, believe it or not, I used to think when I was a kid, man, yoga, that's a joke. Man, yoga is so good.
Yoga I'm glad you brought that up, Dr. E, because I love yoga. I love meditation.
Oh,
I
yeah.
love mindfulness. I think that's so important to the emotional well-being, not just the physical well-being.
Yeah.
But
Let me tell you, emotional, just we all know about the physical, the strength, the exercising, and the compression, and that euphoric feeling after an exercise. That's the same with the mind too. You've got to fail, like, in our office, we still, I still practice. So we have a wellness program that takes the three components of wellness, which is like exercise, diet, and stress. Stress is the mental capacity of how you can cope with it and how you can decompress on your own. Everybody goes through a stressful one, but if you don't know how to like bring yourself down to the parasympathetic environment, you don't want that chronic sympathetic reaction that gives you that state of fight or flight for a long period of time. Then you're actually having like physical like problems because you're constricting these little vessels because when you go to a sympathetic, you have these blood shunting from your arms and legs.
yeah,
And then over a long period of time, you have bad circulation in your legs. Then you have neuropathy. Then you start having poor wound care. And it just keeps on going. So yeah, mental is huge in any aspect of wellness.
Yeah, and like I said, with mindfulness and meditation, I meditate every morning. If you would have asked me, Dr. Rhee, a handful of years ago about meditation, I would have been like, what are you talking about? Like, crossed legs, incense burning and stuff. I ain't doing that shit. But every morning I do, and it really has been a game changer for me. And that ties into everything you just said, with the body and mind,
Yeah.
you know.
Meditation, same with me. I meditate every morning, and it doesn't have to have that 10 minute. You could do 1 minute, but just start somewhere. And it's very hard for someone that's very like me. I've got all the symptoms of everything, from ADHD, ADD. I'm
Oh,
all over the
me.
place. Yeah.
Me.
So just that meditation helps you reset because your mind can go and keep going into a world that you don't want to go into. So that meditation really sets things in a good road as you're going throughout the day.
Yeah. And I'd love to move into what you're doing about unlocking the potential of topical stem cell therapy. So I want you to talk for the listeners, Dr. Rhee, what are stem cells and how, because some people don't know, maybe they've heard of it, and how beneficial are they for us, right now, if you're
Yeah.
suffering with pain and stuff like that?
Okay, so stem cell. So we all heard the buzzword about stem cell. You think about stem cell therapy, and then you can feel, younger, youthful, and almost like an anti-aging. So think about our cells. Our cells need to, recover and really like heal itself through a motion of this thing called mitosis and make more cells. And it goes into the world of like tearing up the old tissue, the metabolic waste, removing that and making new cells. So these stem cells are like the blueprint or how it start off to go into that particular tissue of cartilage, tendon, muscle, so on. So as we age, these stem cells that we're looking at, those stem cells, they kind of age. And then when they age, they start going into a thing called senescence or zombie state. If you want to go down into the biology of it, think about a chromosome or a DNA, right? So chromosomes are the codes that basically codes to what that's going to turn into. So you can have like a cartilage and you have these things called ATCG, and they will basically code from an RNA, DNA replication,
Hmm.
and it turns into like the mitosis cell division. So the neat thing about that is that you have the ability to regenerate, and the younger we are, the better it is. As we age, we start losing those cells, right? We start losing that through senescence because at the very end of these chromosomes are things called telomeres. Telomeres allows us to do the safety mechanism of replicating. If we didn't have that safety mechanism, these codes ATCG will start, if we didn't have that little end cap, well, they'll start mix matching and they turn into cancer cells. So you
Oh,
need something
geez.
to stop it, right?
Yeah, yeah.
So, but the problem is that when you have this telomere stop at a certain length, now the cell goes into the senescence or zombie state. So we have to wake it back up. And the only way to wake it up is an enzyme called telomerase. Now, in stem cell, you have that enzyme telomerase inside there. Telomerase is the enzyme that increases telomeres. So now you've got your telomeres back to its normal length. Now the DNA is ready to replicate into RNA DNA into that cell, right? Now, the thing is that when you see your target tissue, like let's say a satellite cell makes more muscle tissue. Well, it may go into senescence, right, from a zombie state, right? So now you're waiting. So then you get it out because you have telomerized, the enzyme increased telomeres, but now it's still waiting there for a signal. Well, you need these little signals from stem cells, mesenchymal stem cells, to say, hey, turn on that satellite cell to make more muscle. So the signal is for these EVs. So the mesenchymal stem cells secrete these things called EVs. And these like they call it cell-free, no nucleus, just the actual signal that
Hmm.
goes to your target tissue and say, all right, wake up. And that's basically like how we have an endocrine system, right, with
Yeah, yeah.
hormones that secrete. Well, along with that, for closer like cell to cell communication, you have a thing called paracrine. So the paracrine is cell to cell communication. So when you have an information of like maybe like cytokines or proteins or microRNAs that get close to the target tissue, like the satellite cells, it says, all right, here I am, turn on. Now the satellite cell says, okay, it's signaling me to go and make more muscle cell to fix that damaged tissue. So now you're starting that process, get rid of the metabolic waste and making more cells. So stem cell is basically something that we all have in our body, but as we age, it decreases. So that's why stem cell therapy is important because you're introducing more younger, vibrant information signals into your body that says, all right, turn on, regenerate, turn on those telomeres, grow longer, and then get the signals to turn on those particular cells to make that tissue.
Yeah.
So it's a huge cascade of events. But the neat thing is that the evolution of where stem cells started and where it's going is so neat with this new topical
Yeah.
application. Because the worst thing about it is that when you do an injection, you're looking at risk factors, downtime, and cost.
Yeah. And for the listeners out there, Dr. Rhee is the published author of The Future of Regenerative Medicine, Unlocking the Potential of Topical Stem Cell Therapy, which will be linked up in the show notes. So topical, so if explain Dr. Rhee how this works. So when would I use a topical stem
Okay, so
cell regenerative?
So just think about like anything when you have that's a repetitive injury or something that just keeps on, aching and you can't heal it. So that's typically what you hear about like your tissues not regenerated. It doesn't have the ability to heal.
So muscle sprain, something like that.
Tendons, ligaments, anything, or even arthritic joints that the cartilage starts decreasing because this cartilage is getting chewed down. You have to get something to grow back. So what you're trying to do is think about like when you're younger. When you're younger, you can recover real fast. So if you do like a hard event and like when you're 15, the next day you're almost back to normal, right? Because you have the ability to regenerate while you're
Yeah.
sleeping. As we age, because the decrease of these cells,
Takes me two
you know,
days.
yeah, 2 days to do that, and sometimes it may take 6 weeks because
Yeah.
we don't rest it, so we're constantly using it. So you're doing micro trauma, and you're doing that thing called overtraining a particular tissue because you're not giving it the ability to rest. So what regen does, because it has these components, these EVs, these signalers from the mesenchymal stem cells, and then there is a component that has the ability to go through the skin, the 3 layers of skin, and that product is called DMSO. DMSO has the ability to be the vehicle to pull through the skin. Once it gets down to the deep tissue, then it has the ability to hone to the damaged tissue, and then it tells signals, hey, here we are. Let's wake up. Let's turn on. Let's go.
Wow. I love that. And so it really is because I remember like I said before, I mean, I've heard of this is what drew me to your work you're doing is because I've heard of injections of stem cells, like with I told you I have knee problems and they can inject stem cells, but the topical stuff sounds amazing.
Yeah. Now think about like when you had your knee surgery. Do you remember how those disclosures and
Oh
those
yeah. Yeah.
remember how they say you may be risk for infection or poor outcome? So when you do anything invasive, you're looking at, anything that has to do with invasive world, you're gonna get some type of problem down the line
Yeah,
if it doesn't.
infection. Yeah, all
Infection's
kinds of
huge. And think about this. You have a primary injury. Let's say it's your patella tendon, right? And then your patella tendon has that kind of grade 1 in its tendonitis world. So then you're trying to regenerate that, so you do a stem cell injection. Well, guess what? The needle becomes a secondary source of injury. So you got the primary and
Oh
secondary.
yeah.
So that's why there's downtime when you do an injection. Now you have to basically, that's why a lot of NFL players and a lot of pro athletes don't do stem cell therapy injections during the season because there's downtime. They can't afford to be down during the season.
That's where the topical comes into play.
That's where the topical. So that's so the reason why I developed it was because the NFL world, I kept on hearing them talk about I can't do stem cell therapy during the season. I can't because of the downtime and the problems and the risk factors like that. So what they would do is they would go into the pain med world. Now you can play. If you're numb, it's not going to bother you one bit. But the minute it wears off, you're like, oh my gosh, I need Monday, Tuesday, Wednesday recover from all that damage I did, and
Yeah.
then there goes pain meds again. So if that's why I started thinking there's got to be a way. So that's how topical came about. Topical, non-invasive, does it does the same action as the injection, except for now, more importantly, there's no risk factor of the needles.
Now, does insurance, I mean, is it cost prohibitive? Is it expensive? I mean, you need a prescription, I'm assuming.
Well, okay, so stem cell right now is not heavily regulated by the FDA, but it's slowly starting to compress down. But as far as prescription, it's Regen itself, you don't need a prescription, but you have to buy it through a provider. A provider could
Okay.
be anybody like a physical therapist, chiropractor, medical doctor, even
Okay.
massage therapist. And then in their world, they dispense it out to the patient because there's ingredients in there. They're a little heavier than like OTC world, so it's for professional use only. So
Yeah.
because of that, you have to go to someone that has a license that
Which is
have the
good. I
yeah.
was
So you
just
have to
wondering if I
control.
could, I was just wondering if I could go to the gas station down here and get the stuff, which I like. You have to go through somebody like you as a doctor and say, hey, I need this stuff.
Yeah. Now, the big thing with stem cell is the actual like what people think of stem cell. People think that these stem cells turn into your existing tissue. So that's the biggest like I think that the reason why I wrote that book was for that the constant explanation over a period of time. I said, let me just write a book explaining what stem cell really does. It doesn't really turn like stem cell, they think that that stem cell is going to turn into your tissue. It's impossible. There's no way that
Yeah.
that chromosome with that DNA is going to match your DNA. There's no way. So what it does is really it signals. It signals through these things called EVs, your existing tissue. That's all it does. Turns it on. So that's why you hear these words like buzzwords like exosomes. Well, exosomes are carriers, and what's inside of them are those EVs, those messages.
Yeah. Where do you think this is going in the future, Dr. Rhee, as far as, topical stem cell therapy, just stem cell therapy in general?
So this is what's great about the technology now. So like podcasts like you, even Chat GPT, there's so much information out there that not provider, patients are more educated now. They take these shows and they say, all right, I like this. Let me do my own research. Let me pull it up what I can get. It's eventually gonna get to a point where you can go to your provider and ask for that. You can say, hey, I want that. I don't want a cortisone shot. I don't want that. I want the topical stem cell. So
Yeah.
the neat thing about that, it's a home application. So now they can apply it on themselves at home without
Yeah.
the need to be in a high facility that have the high cost. That's why injections cost so much.
Yeah.
When you do an injection, you have to pay for the provider to do the injection. You need the insurance, you need the facility, and then it just that overhead plus cost.
Yeah.
Whereas topical, it's the same ingredient except for you don't have live cells. You're just taking the information and you're encasing it into a regen product, and then that's how you deliver it through the topical side of it.
Yeah.
And
Yeah.
that's why it's a lot easier and cheaper.
I love it because, like the biggest thing for me is not invasive. You just, and is it like a cream or a gel or,
Yep, just like a lotion. It's,
okay.
it's, it's real simple lotion.
Now, I know you've done work, Dr. Rhee, as we wrap up about, you've done a lot of work with cryotherapy.
Yeah.
Can you talk a little about the benefits of cryo? I've never tried it, but I would love to do it.
Okay, so here's the thing about cryotherapy. Cryotherapy, it's not the therapy during the time, it's the aftermath. So what you're trying to achieve, so I guess cryotherapy is so it was developed by a Japanese rheumatologist working with RA patients. And what he was trying to do is get the inflammation, this metabolic waste and inflammatory response from the autoimmune disease and get it out. And he was trying to think like, well, I can't exercise them because, their joints hurt, but I need to do something.
Yeah.
So he thought about what the body, in the autonomic nervous system, you want the parasympathetic. You want to vasodilate all your vessels of the venous and lymphatic system. And when you open it up, it pumps out all that metabolic waste, the inflammatory, that excess junk, that almost that free radicals. You want to get it out of there as much as possible, right? So the way you think about it, you want to put a person into a sympathetic reaction quickly as possible, and then it turns, and then to combat that, you want the parasympathetic afterwards, right? So fight or flight. After that, you calm down, and then you just feel like you just expel yourself, and you feel real tired. Well, that's the parasympathetic. That's what you want to have that. So cryotherapy, because so we used when I had cryotherapy, we had a nitrogen tank that dropped the temperature in this chamber for like less than 166, Fahrenheit. So you want to get as cold as possible, because if you go into a, like a cold plunge or something cold, the first thing your body does, it vasodilates because it wants to heat the area because you feel cold temperature.
Yeah.
Once it recognizes that, hey, my core temperature is going down, I can't warm myself up, it turns the opposite, it constricts. So it goes to the sympathetic where it vasoconstricts all the vessels, shunts the blood to your core,
Yeah. It's
and then
keeping the heat to the core.
yeah. So that's why when people go into a cold plunge in a couple of seconds or a couple of minutes, it goes into that sympathetic. You want to get out of that thing. That's why it takes time. So in a cold plunge, it takes longer. But in a cryo with the gas, nitrogen gas, you right away go into the state of sympathetic because it's so cold. The body senses that. So once you get that shunting of blood, you're in there for about 2 minutes, 2.5 minutes. Then when you come out, the body recognizes, okay, I've got room temperature, quickly vasodilate because we have to send oxygenated blood down to. So when you vasodilate the arteries, you have to vasodilate the venous and the lymphatic system. So then that opens up. When you open up, that cold rush of oxygenated blood that goes down, well, guess what? The return is all the excess metabolic waste, the interstitial fluid, the stuff that you want to get out, it gets flushed out because you got the
Wow.
return back and then flush back. So you want that exchange. So that's why people think, wow, I feel it 5, 20, 30 minutes, an hour after the cryo because it's constantly vasodilating. Some people say I feel I'm sweating again. I'm opening things up. So that's what the cryo is all
And it's
about.
good for you.
It's very good for you, but you gotta know what you're doing at the same time. So if you're doing cryo, like not the cold plunge, but cryo, understand that when you're going in there, you have to be naked, number one, because your moisture can be caught into a clothes. So if your clothes are wet, you can get frostbites. So that's
Yeah.
why you want to go in there with dry clothes and make sure you can sweat on your exposed skin because it evaporates off. But when it's on a fabric and you're sweating,
Oh,
well, that that you know what I'm talking about, right? You'll get
that'd be a
frostbite, but
bad
you don't
day,
want.
Dr. Reed. That'd be a
Hey,
bad day.
you got yourself a good story to tell your friends. No, I'm telling you, this is the truth. This is what happened, right?
No, no, no. I agree. It's a, it reminds me, stick your tongue on a cold pole or something.
There you go. Hey, explain to your wife because that's how I got that burn. He goes, what are you talking about, man? What are you?
Dr. Rhee, as we wrap up, how can people find you, sir? Because you're doing amazing work. You're
Um,
great. You're doing great work.
Yeah, so the easy way is just to go and you can Google my name, Dr. Tommy Rhee, or you can basically go to my website, regen.com. That's RHEEGEN.com. Physical chiropractic, you can look at that. Or, there's some Instagram and Facebook. But you know how it goes. Just kind of follow me along and see where I'm at.
Yeah, Dr. Rhee, I got to come see you in Tampa, brother. I'm down here in South Florida, like we talked about, and all your book, and all your publications are on your website, sir.
Yeah, yeah, just come and take a look at it.
Dr. Rhee, it's been a pleasure, sir. You're always welcome back here, and thank you for what you're doing. Thank you for your service, sir.
Likewise.